Hello, hello everyone. Myself Himani Sharma from RPIT campus. In today's class, I discuss about the definition of social pharmacy. The drug and medicine sector is studied from the social, scientific, and humanistic perspectives. Social pharmacy consists of all the social factors that influence medicine use, such as medicine and health related beliefs, attitude, rules, relationship, and processes. Social pharmacy may be defined as the discipline dealing with the role of medicines from the social, scientific, and humanistic perspectives. Scope of the social pharmacy in improving the public health. In an effort to protect the vulnerable populations from financial hardships, pharmacists ensure the provision of cost effective health care through the rational use of medicine product and modern technologies. Majority of published study has demonstrated the potential of pharmacists in substantially increasing health care saving across various settings, attributing such result to pharmacists expertise in reducing and preventing medication related problems and in providing the cheaper alternative or suggesting medicines that are covered by insurance. Means there are the scope of the social pharmacy in improving the public health. Next is the medical product, vaccine and technologies. With an increasingly wide range of new and analogous medical product, vaccines and technologies, the complexity of pharmacy practice continue to broaden. The role of pharmacists are not only limited to medical product but also include the vaccine and medical devices, especially those that demand the special knowledge with regard to uses and risk. Pharmacists, therefore, are responsible for ensuring the efficacy, integrity, and security of medical product, devices, and vaccines to safeguard a patient health. Next is the health services. As medicine experts, pharmacists hold the responsibility to deliver effective, safe, and quality medicines and services to achieve the optimal health outcomes. Competency in their discipline and up to date knowledge, therefore, are the pharmacist's core in tailoring information and advice to their patient. So in today class I discuss about the scope of social pharmacy in improving the public health and their medical product, vaccines and technologies, and also about the definition of social pharmacy. Thank you.